Preeclampsia. Guys, it is happening so much more than when I started in labor and delivery in 2001. So I'm excited that you guys are here. I really want to help you guys understand what the disease is, what you can do to prevent it, because there are some things you can do to prevent it, and what it can mean moving forward towards your delivery. Now, I have a whole article about this. I'm going to put the link down below. If you want more information, numbers, scenes like that, definitely check out the full article. I actually wrote the article after attending a seminar about preeclampsia with all of my notes and statistics and information. I hope you guys will check it out. And of course, when you're learning about preeclampsia, definitely learn from an expert. I'm seeing doulas sometimes saying, why do they even check your blood pressure at appointments? It's always high. Hello. We're checking it because it's one of our first signs of preeclampsia. So make sure that you're getting your information from an expert. I have 20 years of labor and delivery experience, and I have managed hundreds of patients with preeclampsia. And like I said before, the rate that we see preeclampsia is increasing. We're not exactly sure why, but we do know that. Okay, so what is preeclampsia? Because I think this is something that's really not understood well on the internet. And I'm going to pull out my phone because I want you guys to know that I'm getting this exactly right. And I think it's important that I get it exactly right. So here we go. It is a multi-system organ dysfunction that only occurs when a placenta is involved. So you don't get preeclampsia at any other time in your life. It also only occurs in humans. We do not see this in animals. And it decreases organ perfusion. So that means how much blood is getting to the different organs in your body. It is actually one of the leading causes of maternal mortality. So extra glad that you guys are here so that we can understand this together. And they believe that it starts at conception and really kind of grows along with the placenta. And I mentioned in here that there was something that you can do to prevent it. It's not really prevent it. So you can take low dose aspirin. Now check with your provider about what kind of aspirin you should be taking, because I think the guidelines on this are going to be changing a little bit rapidly. But I got to tell you that when I started, aspirin was a big no-no during pregnancy. And so when I started to have patients who were coming in saying, I'm taking aspirin during my pregnancy, I was like, oh, why are you doing that? And in fact, in other countries, higher doses of aspirin have been shown to either decrease your chance of getting preeclampsia, eliminate getting preeclampsia at all, or getting it later in pregnancy so that it doesn't affect you during your pregnancy. So huge aspirin fan. They do recommend that you start at about 13 weeks, hopefully getting onto it before 20 weeks of pregnancy. Now I should note, not everyone is supposed to be taking aspirin. There is guidelines on who should be taking it and who should not be taking it. Like if you have had gastric ulcers, they probably are gonna not recommend that you take it, but check with your provider to see if it is right for you. If you aren't on aspirin and your provider hasn't talked to you about it at all, definitely talk with them and see what they're recommending for you. In fact, I just saw that people who are having twins should take double the amount of aspirin because they have 2 placentas that they need to cover. So totally interesting. And again, I think the guidelines are changing. And talk to your pregnant friends about this, because I think a lot of people are caught off guard, kind of like I was when people first started taking aspirin. And kind of like when we switch babies to laying on their back instead of their belly, we need the community support to realize that aspirin can be really important during pregnancy. And again, it's not eliminating the risk of preeclampsia. It's hopefully decreasing your risk, or maybe you don't get it until later in your pregnancy, things like that. And again, we're starting it early in pregnancy because the belief is that preeclampsia grows with your placenta. It starts at conception and it's just kind of there with you. And hopefully aspirin can mitigate that risk. Now, we don't exactly know what causes preeclampsia. There are definitely risk factors: advanced maternal age, multiples in pregnancy, twins, triplets, etc., increased BMI, gestational diabetes, a lot of things that just make you higher risk, make you at more chance for having preeclampsia. But I gotta say, we're still seeing preeclampsia in young, healthy individuals. So it can be a risk for lots of different kinds of people. Okay, what are some of the signs and symptoms of preeclampsia? Because unlike gestational diabetes, which I have a whole video on that you guys should watch as well, there are signs and symptoms of preeclampsia most often. Now, one of the ones I see really frequently is kick counts, which you guys are like, what the heck, Hillary? That doesn't make any sense at all. But I've had so many people say that their kick counts started to be off and they went into their provider saying, baby seems to be moving less. And the provider found out that they had preeclampsia because kick counts were off. So I'm a huge fan of doing kick counts. If you don't know how to do them, I have a whole cheat sheet down below. And as a fun fact, so many providers are teaching kick counts wrong. We're really working to change the language and how people do kick counts in the United States. But as you can imagine, it's a big country and it's taking a little while. So grab that cheat sheet down below to make sure that you're doing them correctly. But beyond fetal movement, there's other things that we're watching for. And these are things that they do routinely at a lot of your prenatal checkups. The first one is blood pressure. Yep, when you go into your provider, they're going to check your blood pressure. Now, I hear a lot of people saying my first blood pressure is always high in the doctor's office. And I totally get that. Mine was high too. Something they can do is check your blood pressure again as the appointment is progressing. I know for me, once we got there and we were talking and my child was settled, a lot of times it was high because I was like hauling all their crap into the room. Maybe I'm the only one who had to do that. But once they were settled and I was settled, we took another blood pressure and it ended up being fine. I also had a blood pressure cuff at home, so I was checking it regularly on my own. I think having a blood pressure cuff is a great idea. A lot of times they're pretty cheap on Amazon or your local drugstore, so I would check it out or borrow your mom's if she's not using it during this pregnancy. And postpartum, because we're going to talk more about that. Stay tuned. Okay, once they see your blood pressure is elevated, also in most prenatal appointments, they're checking your urine. So they're checking for protein in urine, sometimes glucose in your urine. That's what you're giving the pee sample for. Also, it can be sometimes checking to see if you have a UTI, because those can be really common during pregnancy. But one of the big things they're checking for is protein, because as preeclampsia happens, your kidneys just sort of open up and sometimes they start to spill protein into your urine. That's what happens as a symptom of preeclampsia. So that's why we're checking for protein in your urine. Now, if we see that increased protein or higher blood pressures, your provider might order PIH labs. Now, PIH is the word that we used to use for preeclampsia, but maybe they call them preeclampsia labs where you are, but it's just a series of labs that check for things that could be off with preeclampsia. And we're going to talk about those a little bit more, so stay tuned about lab work. Now, you might have heard swelling, and swelling can be a symptom of preeclampsia, but the problem is it can also be a symptom of pregnancy. So no longer are we taking swelling really as a symptom of preeclampsia. However, if you wake up and suddenly you seem to have really swollen legs or swollen nose, a lot of times people will notice, I'd call your provider, because swelling that just appears isn't usually how pregnancy swelling goes. You'll kind of notice it getting worse with time. I think that's worth mentioning to your provider if all of a sudden you notice a lot of swelling, especially in the nose. Now, headaches. Often I hear people say it is the worst headache of their life and it's not resolved with Tylenol, sleep, or water intake. It's tricky because headaches happen a lot during pregnancy. And so I don't want you to freak out every time you have a headache, but usually people are saying that this is a pounding headache. If I had somebody come into triage saying this is the worst headache of my life, I almost didn't care what your blood pressure was. I was probably rooting for PAH labs just to make sure that that wasn't an issue. And this is something they're going to continue to watch for your first 6 weeks or so postpartum as well. You can also get blurry vision because of how it reacts with your body. So if you're having blurry vision, some people say floaters. I am hesitant to say floaters because that can come from allergies or whatever, but usually you get just blurry vision. Definitely talk with your provider if you have any questions about how your vision's changing during pregnancy. Also, as your liver floats up, you can get abdominal pain. Usually it's on your right side because that is where the liver sort of moves up into your ribs and area. I have a whole video on rib pain, and if you're having rib pain, it's something you definitely want to talk with your provider because it could be your liver. More likely it's other things, but if it is your liver, we need to check it out. Now, a lot of times preeclampsia is called HELLP syndrome. That was one of the things that we really called it when I started in labor and delivery, and I like it because it helps us remember a couple of the things about blood work. So the HELLP words stand for hemolysis, elevated liver enzymes, LP, lowered platelets. So those are two of the big things that we're watching for on labs. So if your liver enzymes are up, because that liver's going up, it shows that the liver's kind of compromised. And then lowered platelets happens because of how preeclampsia works on your body. Another couple things that we're watching for is uric acid. Most often in preeclampsia, that's elevated. And again, protein in your urine. And they can actually order either a 24-hour protein, although I hope we're stopping that because you have to keep your urine on ice, which is so annoying. And they've come out with a protein creatinine ratio that you can just take once. And thank goodness, because I always felt so bad for people having to like either keep their urine in their fridge or whatever. Anyway, checking the protein in your urine can be really important as well. Really quick, have you had any symptoms of preeclampsia? Are you concerned about it? Are you at risk for it? Tell us down in the comments. Now, I want to be really clear that, like everything, there is a huge spectrum of preeclampsia. Some people get it very mild and some people get it very severe. So you might start to see your blood pressures trending up a little bit. Maybe one of those labs is a little bit high. Maybe you're just spilling a little protein in your urine. Now, you can have the discussion with your provider if you should get induced to stop it from getting worse, or you could see if they are comfortable having you wait for a little bit. Remember, having an induction for anything like preeclampsia is something you can ask questions with your provider. You don't just have to take them saying, hey, I think you might want to get induced, and you go, okay, and then you feel forced getting induced. Because again, like I said, this is a really big spectrum. There's a lot of labs that we're looking at, and I gotta say that some of this is very black and white. There are sometimes labs and blood pressures where I'm like, this girl is going to stroke out or have a seizure. We got to get this baby out. But most often we're seeing things starting to trend upward, which isn't great for you or baby, but it is still a conversation you can have with your provider. Now, at this point, I want to mention that just because your blood pressure is going up does not mean that you have preeclampsia. There is something called gestational hypertension, in which your blood pressure starts to rise without symptoms of preeclampsia. So again, they would see that blood pressure rising, they would do the preeclampsia labs, but they would notice that they were all normal, but your blood pressure is up. And providers should be offering to do something about your increased blood pressure. Cardiomyopathy has been shown to be a real problem in pregnancy. It is when your heart enlarges because it's having to work so hard. And increased blood pressure can cause pregnancy-related cardiomyopathy. So if you're having increased blood pressure, ask your provider if they want to give you anything for that, as long as they've also made sure that it's not preeclampsia. Now, with preeclampsia, sometimes they'll give you blood pressure medications as well, because we need that blood pressure to go down. However, blood pressure medications are not going to solve preeclampsia. They're just treating the symptom of high blood pressure so that it's not putting extra strain on your heart. We really need to be taking blood pressure seriously. It really is a problem, even though you think I'm young and healthy. There's no way my blood pressure is up. I see you, I understand that, but we got to be taking it seriously. And a lot of providers seem to be really hesitant to order blood pressure meds, even when blood pressures are elevated. So something to talk with your provider about. Okay, so what are the treatments for preeclampsia if blood pressure medications aren't going to do it? Again, they might give you blood pressure medications. The real treatment for preeclampsia is getting this placenta out of your womb, because it's the problem child with preeclampsia. Obviously not your sweet baby. It's just the placenta, which you'll ultimately throw away. But it's important that this come out, because that is the solving factor for preeclampsia. Now, of course, you're thinking, if my placenta's out, then there's no chance of it postpartum, but stay tuned. Our bodies are sometimes just torturing us. Usually in the hospital, if we're seeing symptoms of preeclampsia, we will start you on magnesium sulfate, and it relaxes the smooth muscle in your body, so you're less likely to have a seizure. I don't know if any of you are Downton Abbey fans, but the youngest sister ends up having a seizure, and it is, and I love how they say it in the films, preeclampsia. I don't know why I'm laughing about that. It was a horrible episode. Lady Sybil actually died of eclampsia, which is when you start to have the seizure. And we are trying to do all the things to keep you from eclampsia. That's why it's called preeclampsia. We're having the signs that you might be headed there. So the magnesium sulfate is on board to prevent those seizures, especially during labor. It is something that we only give in the hospital. It's kind of a tricky drug, and we really have to monitor you closely. And I've got to say that if you get put on magnesium sulfate, it tends to make you just not feel great. You tend to be really hot. Great idea to bring a fan from home if you have one, although most hospitals I've worked in have fans that we can put on your face. But it's not my favorite drug, other than the fact that it keeps you alive. Huge fan of preventing seizures. Now, our other things that we do in regards to preeclampsia tend to be because you're on the magnesium sulfate, and we need to watch it so carefully. We definitely need to watch your urine output. A lot of times they're going to put a catheter in because we need to make sure that your output is adequate. Also, a lot of times you just don't feel like getting up to the restroom. So some people find it really helpful. If you're absolutely hating the catheter, you could ask them to maybe put a commode by the bedside so you could just pee that way. Now, most often preeclampsia doesn't happen until your third trimester, although there is some earlier onset preeclampsia. But if we're seeing high blood pressure mid-pregnancy, we usually think that's more gestational hypertension than just preeclampsia. We tend to notice preeclampsia later in pregnancy. And of course, talk with your provider about aspirin. Yep, it's a soapbox for me to see if it can help decrease your chances of getting preeclampsia. Now, I said that getting this placenta out was the key to preventing preeclampsia, and it is true. Hillary, 16 years out, not going to be getting preeclampsia now. But postpartum, you are still at a risk of preeclampsia. Now, you can be at a risk of preeclampsia if you had it during pregnancy. It might rear its ugly head again, but you can also get it even if you did not have preeclampsia during your pregnancy, which means in those first couple months after you have this little baby, you need to be watching for any signs or symptoms of preeclampsia, which tend to be the headache. And again, if you've had issues with blood pressure, please consider getting a blood pressure monitor so you can especially monitor your health after baby is born. I got to tell you, it is so easy to ignore problem signs in yourself after this baby is born because you are just mostly watching out for this baby. But you got to be watching out for yourself because there are far too many people dying from things like this after they have their baby that we could easily catch. Pro tip, if you go into the hospital with a headache, your first thing that you say is, I just had a baby X number of days or weeks ago, and I have the worst pounding headache that I've ever had in my life. They should take that extremely seriously. We are working on educating emergency rooms so that they know that that is something really important that we get checked out right away versus somebody who just comes in with a headache. These things are very different. And if you're looking for more information about postpartum, I actually have a class called Postpartum Care Made Easy, where I go over the problem signs, the ones that you should head directly into the emergency room for versus the ones you should just be calling your provider about. I think it's great for you, and I think it's great for your partner, maybe even your mom, whoever is going to be surrounding you after you have your baby, because everybody needs to be watching for those signs because it's so easy for mom to ignore them. I'm going to put the link down below. It's totally free. There is a little upgrade if you want me to go over it with you, or the full class is included in the online prenatal class for couples, which is a great way to both get prepared for birth and postpartum. Now, a lot of people wonder what this is doing to baby. Now, if you have organ shutdown, that obviously is going to affect baby, but it's kind of surprising. It doesn't have that much of an effect on the baby unless they end up needing to be born early because of your preeclampsia is getting so severe. So baby is not ultimately affected too much by preeclampsia other than the byproducts that it might be affecting mom, which is not a good thing. But there you go. This baby will do what they want. Editor Hillary here. There are times that babies can have problems, usually because as it decreases blood flow to your organs, it also decreases blood flow possibly to the baby. So there can be issues with baby not getting enough blood flow. But usually when we think of how problematic this is, it's surprising how little it is problematic for baby, even though they're sort of causing the problems. I just wanted to insert that. By the way, I hope you enjoy expert advice about preeclampsia like this. If you do, please give this video a like. There's a lot of information, but I think you want to know this kind of information. And give me a follow so we can hang out for the rest of your pregnancy. Now, preeclampsia is definitely one of the things that starts needing third trimester testing. I have a whole video about it that I'm going to put up here. But remember, preeclampsia is important to be checked for, and it's important to do your kick counts because it can actually show preeclampsia as well. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.